The Galien Foundation fosters, recognizes, and rewards excellence in scientific innovation to improve the human condition.
André Malraux said once in one of his novels, Une vie humaine ne vaut rien, mais rien ne vaut une vie humaine. Human life is worth nothing, but nothing is worth a human life. All these men and women are trying to save human lives. Is there anything more noble than that?
Around the globe, the Prix Galien is considered as the equivalent of the Nobel Prize for the industry mobilizing an unrivaled network of Nobel laureates and top biomedical scientists. The Galien Foundation manages an independent, cross-functional, and geographically diverse program of events and sponsorship to brand the best of the best in new medicines and diagnostics. The Prix Galien is a welcome initiative to stimulate creative research and promote excellence. Barack Obama. The Roy Vagelos Pro Bono Humanum Award for Global Health Equity is bestowed to an individual, a company, an academic institution, or a non-governmental agency that has helped to improve the human condition through the application of biopharmaceutical science to problems of developing or underserved populations worldwide.
This is the right event, on the right issue, at the right time.
I thank His Excellency the President for bringing Prix Galien to Africa, and I look forward to the day when we will celebrate an African winner of the Prix Galien.
I'm particularly grateful to receive this award.
The awards are among the highest honors in science and commerce because they lead to improvement in the human condition.
The Prix Galien Awards recognize the world's brightest minds and most innovative companies. They are a true celebration of the hard work required to produce life-changing interventions.
That is what makes us optimistic about the future.
Congratulations to all of you.
Make a difference. Join the Galien Foundation.
And audience, on behalf of the Galien Foundation. I'm Kenneth Mock, a serial biotech entrepreneur and currently a senior advisor to the chairman of the Center for Global Health Innovation and the Global Health Crisis Coordination Center. I am delighted to serve as the moderator of today's webinar. This webinar is part of a series of webinars that the Galien Foundation will host over the course of 2021 to explore the intersection of ethics and global health as the lead up to the November 10th through 11th, 2021 Jerusalem Ethics Forum, and in support of the Foundation's mission to catalyze innovation to improve human condition. Galien is also hosting webinars focused on digital health, disease-specific issues, and Africa's growing role in medical innovation. And we are all pleased to be part of this noble effort. So let's dig in. The availability of multiple COVID-19 vaccines has brought into focus the issues of equitable distribution and economic recovery, and highlighted the differences and distance between economically advanced countries and low or middle income countries. According to an analysis by the Duke Launch and Scale Speedometer, confirmed purchases of COVID-19 vaccines amount to 8.6 billion doses, with an additional 6.3 billion doses currently under negotiation. This is data as of this week. Of the 8.6 billion confirmed doses purchased, 6.1 billion have been purchased by high and upper middle income countries. Lower middle income countries hold 703 million doses, and low income countries hold 670 million doses. The distribution disparity is clearly real. Today's webinar will feature perspectives about this disparity from experts in ethics, economics, industry, and government on how ethical and economic considerations and on-the-ground experiences have played out during the COVID-19 pandemic. More specifically, we will look at how ethical and economic forces are impacting actions by industry and government as leaders consider the statement that none of us will be safe until everyone is safe. So how can this principle become a reality? Should each government focus on their own population, or should the focus be on the global population using the collective efforts of businesses, governments, and other multinational organizations? How does one assure that economic recovery occurs globally? And is the path through moral suasion, through economic motivation and incentives, or through a combination thereof? So before turning to the panelists, we would like to frame the conversation with a question to you, the audience. We will share the results of this question at the end of the webinar. So please see your Zoom screen right now and mark the comments that you have. These questions are all components of today's timely topic, which we'll dive into immediately after a brief introduction from each of our panelists. So let's go alphabetically. First, Arthur Kaplan, PhD, professor and head of the Division of Medical Ethics at NYU Langone Health. Art?
Hi, thanks everybody for attending this. Thanks, Ken. Thanks to the foundation. This is a great opportunity. You know, normally in discussions, the ethics folks wind up following the economics folks. So I think it's a marvelous chance to have the ethics point of view pointed out first. And, you know, not that there's consensus among ethicists about how to deal with the pandemic, but many of the issues that have been battled out are primarily ethical. And I'll just say two things. One, I think in the United States, we have seen many ethical issues unfolding with respect to the rollout of vaccines and prioritization internally to the country, with all kinds of judgments being made about who should go first and how to manage that, which we can discuss. And then there are important, as Ken said, international questions about what do we owe each other. I looked at data today from Brazil. The country is falling apart. The health system is overwhelmed. COVID is out of control there. That country is becoming in desperate need of help and assistance, just to give one example. So plenty to talk about, both in terms of internally what should countries do and in relation to one another.
Great, thank you, Art. We'll delve into that obviously some more. Next, Awa Marie Kolsek is the former Minister of Health of Senegal and the president of the National Committee for the Extractive Industries Transparency Initiative, also in Senegal. Awa?
I am Awa Kolsek from Senegal. As you said, we have a lot of issues linked to ethics and also economics when we look at what happened on the ground. And I think that I will be happy to give some examples of what is the real life in countries, particularly low and middle income countries. And I will focus in Africa. Let me tell you that what we have seen is that many healthy countries have committed to buying many times more doses than they need really sometimes, while much of the rest of the world is struggling to have one vaccine or to start vaccine campaign. It is why I will be happy to develop this later and tell you that we have in the ground a lot of problem of access, which we can consider as a sort of ethical issues. And some of us are speaking and taking the word, I don't like too much, but it is a word of vaccine nationalism, because we are seeing that it's like this is for some countries and not for all the countries. And we are very well supported now by some initiatives who are focusing on equity. And I will tell you that also, as we have said in the US, for example, you have problem of prioritization. You have problems also of strengthening the health system in some issues. The issue of local production all this is on our plate, and we will be happy to share this with you. Thank you.
Perfect. Thank you, Awa. Next is Shemnem Kalemli-Ojun, PhD, Professor of Economics at the University of Maryland in College Park.
Yes, hi. It's great. It's a great pleasure to be here today. Thanks so much to my co-panelists and Galleon Foundation. This is an extremely important event. And I do agree that ethics issues are very important, and they should be the most important. But unfortunately, the reality on the ground is that ethics is not moving us forward as it should. So what we have done is to analyze the economic side of the issue in order to convince advanced economies, rich countries, that it is in their best interest to invest right now in a global equitable distribution of vaccines and therapeutics in terms of economics. Otherwise, they are going to have huge economic losses, even they manage to vaccinate every single citizen in their own rich economies. And this is what our work shows, and I'm going to later on talk in detail about these numbers, these economic losses to rich countries from not vaccinating poor nations of the world. Thank you.
Thank you, Shebnem. And finally, Russ Medford, PhD and MD, the founding chairman of the Center for Global Health Innovation and chairman and CEO of Covenos. Russ?
Thank you, Ken. I want to thank the Galleon Foundation and my distinguished panelists. It's an honor to be participating in this. The interface between ethics and economics, I think, has always been given short shrift for a whole series of reasons based on human behavior and cognitive dissonance. And the concept that global health for those in the West and the United States was a problem that occurred elsewhere. I think what the COVID pandemic has demonstrated to our corporate leadership and political leadership at this point is this is a war that has come to our shores, that we have not taken this seriously, and that the ethics and economics are intertwined for us to extend our resources and treasure to ensure stable and growing societies, not just overseas, but in the Western societies and the United States itself. I think we have an opportunity to break down what I think are arbitrary barriers now. And this panel discussion will focus on that, I hope, at least for my section, it will.
Great, Russ, thank you. So let's go back to ethics and art and dive a little deeper into your introductory comments. As we just noted, early on in the pandemic, many wealthier nations structured deals with multiple companies based on the belief that not all of the experimental vaccines would succeed in development. But happily, and as a result of the multiple successes, these countries have found that they have committed to buying many more times the doses they need, while much of the rest of the world has struggled to secure vaccines for their citizens. And while entities like CEPI and Gavi and the World Health Organization and the COVAX initiative work to deal with this imbalance. So Art, how do you see this in detail from your ethics perspective? And perhaps more importantly, do you, and if so, how do you see ethical considerations influencing the actions of country leaders and global corporations?
Well, just to get us going in a provocative way, I'm going to defend a modest version of vaccine nationalism, what Awa mentioned, a modest version. And here's what I mean. You can see in the US, but in many other countries, the UK, lots of countries, attention to the local population and high-risk people. In the US, it was clear that what we tried to do was stop deaths. That was the agreed upon moral goal. We were out of control. We've had 540,000 plus deaths here, more than in many, many wars combined. It had to stop, and the citizens expected the government to do something about it. Morally, I think that's correct. You have to get the pandemic under control in your own country. Put it this way, you owe something to your neighbor. You owe something to your family. You owe something to your nation. That's part of what we talk about when we have nations, that there are special bonds, special relations, but they don't extend to infinity. And this is where I think the economics will meet the ethics. once you get your country stable, you get the death rate down, you tamp down the rapid spread of the disease, you start to go back to school, you start to gear up your economy, then I think you start to look overseas and say, what are we going to do to help others? I'm going to give this a simple description. Think of it as the airline mask rule. Put your own mask on before you help other people. If we're a mess, we're not helping other people. But more to the point, if each individual nation doesn't pay attention to the special, intimate relations that its citizens have, then it is not going to make any sense to those citizens to try and rescue the world if people are dying in nursing homes down the street, which my mom did. And you're going to have an expectation that you have to look out somewhat for your own. So that's what I would call modest nationalism. It's not vaccinate everyone in your country. It's not hoard vaccine in case something breaks out again, but it is pay attention to your own nation in terms of what I'm going to call getting stable. And we can talk with the economists about what stable means and talk with the government and policy people about what that means. It's up for argument. But the point is, you have to be willing, I think, morally to make the concession that it isn't just selfish, and it isn't just greedy, and it isn't just ignoring the world to say we've got to get some attention to our own people as we then look elsewhere. And you could see it in every country's policies. India is doing what I'm talking about with a tremendous capacity to make vaccine. They're devoting something like 75% to India, 25% outside, but that kind of is reflecting what I'm talking about in terms of a modest nationalism. One last point, Ken, and then I'll let others get into this. In the US, we learned something else, and this may be important for any nation that's thinking about a rollout. We had moral agreement on what to do, but we couldn't implement it. We agreed to stop deaths. We agreed to prioritize the elderly. We agreed that the healthcare workforce had to be stabilized. Once we got past that, we couldn't figure out whether we should be vaccinating people with asthma, vaccinating people who are policemen, vaccinating people who said that they were smokers. The whole thing fell apart quickly. So if there's one other moral rule that we have to pay attention to, it's an old one from Immanuel Kant, famous 19th century German philosopher. Ought implies can. There are many moral ideals we might put forward, but if you can't implement them, then you can't set the moral bar too high. So in the US today, I'm starting to argue we shouldn't be micromanaging anymore. We should start to roll out vaccine, get the country stabilized, just give out vaccines to anyone who can show up at this point, having tried to take care of the highest risk groups, and then we'll be ready to turn to our moral duties to others outside the US.
Thanks, Art. And let's take that now into the realm of economics and how that cross interacts. Shebnem, you authored a study which concluded that wealthier nations would reach significant economic benefits if they paid roughly $27 billion that was needed to fully fund the COVAX program to vaccinate the populations of developing nations. And your analysis projected that because of international economic linkages, failure to vaccinate these nations would cost the global economy up to 9.2 trillion, with half of that cost falling on the wealthy nations. So given this finding, how do you see wealthier nations responding to your argument that no economy fully recovers until every economy recovers? And more specifically, in your many conversations with colleagues and collaborators, do you see these economic findings as driving action towards funding the disparity in vaccine manufacturing and distribution to the third world?
Thank you, Ken. We definitely hope so, that our findings are going to drive change in terms of policy action. One thing we learned about the pandemic is hope for the best and prepare for the worst. And that's what we do in our study. We give you the worst case scenario numbers, but we also hope the best that these numbers is going to create action in terms of policies on the advanced economies part. Now, the story goes exactly through international linkages in terms of exports and imports, and why advanced economies bear half of the cost, 50% of this global cost in the case of not vaccinating emerging markets and developing nations, is because advanced economies are large and advanced economies are a big part of that global trade and production network. And in that sense, actually, they also understand that. But I would like to now link back to what Arthur said, right? Advanced economies do understand that. They know that global trade and production linkages are important for them, and they will understand there will be losses to them. But of course, advanced economies acted so far as we have to take care of our own first, because we have to stabilize our own economies. I fully agree with that, because you have to first put your economy back to some shape in your own country, and that goes through controlling the pandemic. So you have to normalize demand in your country and supply in your country, and that goes to controlling the fear factor. The people have to stop being fearful going outside. So you have to first control that, and you have to first get that in order in your country. But after that, there will be extra losses, economic losses, from not vaccinating the other countries, especially if you are a rich advanced economy, because you are a large player and a large country in the world trade. And there, again, I think advanced economies are starting acting on that. They already knew that, but they had to control the pandemic in their own economies first. And now they are, I think, starting acting on that. And US is a very good example here, because US is faster on vaccination than Europe. And as we know, the extra accumulated vaccines in US, now US understands that they don't need, is going to go to Mexico and Canada. And, Mexico and Canada, obviously very important here, because they are large trading partners of the United States. So this goes exactly to our channel and how we estimate our cost through these channels. I am, hoping and expecting to see this is going to increase over time. European Union behaving the same way, Japan, Canada, other advanced countries, UK behaving the same way. But especially in European Union, the situation is a kind of a mess right now. So, we have to be pragmatic. The reality on the ground is, I don't think any advanced economy will move forward without taking care of their own first, and then somehow had a handle on the pandemic in their own domestic economies. But again, we really want to push this message that no economy recovers fully until every economy recovers. We understand that you have to have some sort of control on the pandemic in your own country, but then you should really act to invest in this global equitable vaccine distribution, for the rest of the world, because you are going to otherwise bear losses from the trade side. And here, two factors are very important. Not hoarding, right? Yes, you are going to vaccinate your own people, but there's no reason to hoard. There's no reason to have vaccines that passes the number of your population, right? And number two is invest in increasing the supply of the vaccines. And that's what, Gavi, COVAX initiatives are trying to do, right? They are not trying to say, okay, let's just, share what you have. Let's, operate in an environment with fixed supply on vaccines. That's not what they are doing. They are very much on increasing the production, increasing the supply of the vaccines, and solving the distributional problem. So I think that's something very important to keep in mind.
Thank you, Shebnem. Russ Medford, your organization is one of the first to work with multiple multinational companies to help coordinate their actions in response to the pandemic. And you have personally written about the need for a framework for decision makers to bridge the gap between health equity, and economics. So from your perspective, how are you seeing these international businesses deal with the ethical and economic perspectives that we have just discussed?
It's been a remarkable evolution since we were thrown into this fire in March of 2020, when the CDC called us to stand up our crisis center in a desperate. We were desperate to deal with the pandemic in the United States proper. we were completely unprepared for this. We were unable to execute on plan. We were unable to agree on priorities. I think it generates here in this country a great deal of humility that with all of our legacy and self-image, that we need to learn and need to change how we approach these problems. What I found, though, is working with some of the largest technology and logistics companies now, they jumped in feet first right away. I think there were two reasons for that. One was the usual global citizenship, corporate citizenship. We have technology and approaches. You need help, tell us where we can help, and we're going to apply resources. The second, frankly, was fear. And this is at the highest levels of the organizations. We were looking at a destabilization of what we assumed was a stable societal structure in the United States and in Europe, for example. The issue of society collapsing and the economic system collapsing was no longer a theoretical possibility, it was a real possibility. And these organizations were able to find the justification for investing both from a corporate social responsibility and ethical standpoint, but also to justify from a business standpoint enhanced levels of commitment and what I would say business level or operational level investments going forward. I like to say that when we plan our 1, 3, and 5-year strategic plans as corporate leaders for our organizations, we make an assumption that our society is going to be there in 5 years for us to implement marketing and development plans. All that was thrown up into question, actually, and continues to be a question mark. So uncertainty in corporate development and strategic planning now has to be incorporated. I think the other point that was raised, and Art raised, and I'm delighted, Art, that you raised the provocative point here. This was situational. We were unprepared for this. We fell behind the curve. We were unable to, as the United States, get our house in order rapidly and then take up what I think is our rightful role to deal with the rest of the world immediately as soon as we get our house in order. This is not going to happen the next time if we are smart about this. And in that respect, and I think Awa will discuss this, part of our response to COVID from a corporate and government standpoint has to be forward deployment of our resources and assets. This is a global problem that we're never going to get away from. We must survive. We must be able to deal with this disease on a global basis. And just like in military defense, you forward deploy your assets, which means throughout the world, not just the United States, we have the surveillance technologies, the health systems that can utilize that data sets, forward deployment of manufacturing capacity to be able to distribute the production of key therapeutics and vaccines that are not dependent on single source suppliers. I think we have an opportunity here, given the shock that we've had to the system, to begin to break down that preconceived barriers that we had that prevented us from making those fundamental investments, both from a private sector standpoint and from a government sector standpoint.
Thanks, Russ. And we're going to come back to a lot of what you just mentioned when we get to our final question, which really looks at the COVID-19 pandemic as a societal black swan. We'll come back to that. But let's move to Awa. Your perspective is unique as a result of your involvement with global health initiatives, as well as with issues of health in a very specific African country. So looking at the intersection of ethics and economics, what are the on-the-ground realities for policymakers and populations in low and middle income countries? And in looking at vaccine supply as well as distribution, what is and has been working well to accelerate vaccine access, and what are the challenges?
Thank you. I would like to focus on main issues of access. On the ground, we have the issue of timing. We have all observed the delay we have in the country from the north and also the middle and the middle income countries. And what we have seen is that we have waited sometime for 3 months before having the first vaccine. And this has created a lot of problem for policymakers, but also the population. And to come back to what have been said, I agree that people need to look at their own country, stabilize things, but they have always to take into account what are their partners. Because at the end of the day, we are a global village and we will come back to work together. And if some countries have already understood it by supporting countries, giving them some vaccine, not a lot, but at least giving some way, showing solidarity. Because tomorrow people will have to come back to these low and middle income countries where you have a lot of natural resources, etc., etc. And the economy, I agree completely, will not work if people are just in their own countries thinking that they will go very high and very far with their own development. It is why the timing was something important and people put it as an ethical issue. The issue of the cost. When a lot of countries have tried to purchase a vaccine in small quantities, but always it was at a higher price because the negotiation with pharmaceutical industry are more difficult when you have a small population or if you are buying a small amount of vaccine. For example, in South Africa, they were paying $5.25 US dollar for 1 dose, and in Europe it was 3.5. But worth in countries like Uganda, it was $9. And in Senegal, they bought vaccine from China to start at $19 a dose. So it's just to say that when you are not well organized or you are a small country, you wanted to buy yourself, it is very difficult and the price is really a challenge. When we want also to look at what happened in our countries, it was the issue of donation. Donation from China or from Russia given to Guinea-Conakry, for example, for China in other countries, but also bilateral donation and equipment given. And the COVAX, as said, was the one multilateral initiative where people were looking at equity. And it started only in end of February, beginning of March in African countries and started by Ghana and Cote d'Ivoire. But also we had a very important point in Africa, which is the issue of variants. And South Africa is also experimented it, and donation or purchases are also important there if they want to be sure that the vaccine will be efficient. But still, we don't have really a good coverage. And when I look at the figures from WHO, I can tell you that some weeks or 1-2 weeks ago, it was less than 2% in Africa. I would like to also add another point, which is the issue of prioritization, because we don't have enough vaccine. And you have to see who will be vaccinated. And we look at, for prioritization, in all the country, it was those who are more exposed and those who are more vulnerable. But if you look at it, at the end of the day, it is difficult really to have the number you want. And we did it, but what was a problem in some countries was that the population was very upset because some people, we call VIP, were just crossing the line and coming to be vaccinated with their family or with their friends, which was not part of the vulnerable population or exposed people. This is something we have seen, which people are working on, because the civil society, the population in general, is really not happy with that and is really saying in the social network, etc., that we need to change it. So this is an issue of transparency, and a lot of people are working on that to avoid this to happen. We have another point, the health system strengthening. During all this time, what we have seen is that countries are also strengthened their health system through this campaign of vaccination, using expanded community health workers, for example, but also we have seen that some countries have used now what we call portal digitalization, which is electronic vaccination data system, which will be used now for other things too. So this is something to strengthen the health system. We have also the issue of communication, because of all the fake news we have in a country where people will be more influenced by just a video or something people are putting there to say, no, don't go to vaccination, it's not secure, etc., etc. Last point for me is the issue of local production. Somebody has said that if the pharmaceutical industry wanted, they have not enough products. And it is why in Africa particularly, because India has taken the lead already, but in Africa we are looking to, with the African Union, to support countries where they have already some structure producing vaccine, like Morocco, South Africa, Senegal, and some other countries, to ensure by supporting them that we can also produce COVID-19 vaccine. And this will help, because it is not possible for 4 or 5 pharmaceutical industry to give and to produce vaccine for all the world. And we need to count on our real force and count on ourselves. And these are the points we have seen in the ground, and which are the lot of discussion around that in low-income countries and middle-income countries. Thank you.
Perfect. Thank you very much. Thank you, Awa. So let's take a moment and look at the 4 comments from the worlds of ethics, economics, industry, and government. And given your different backgrounds and areas of expertise, the next question is whether you have any comments on the introductory comments by your fellow panelists. Is there anything that you heard that strikes you as new, or a way to think about your particular issue and perspective, helpful or a hindrance? Or, I think that would be a good way of intermingling the points that have been made.
So I have 2 comments, if I can.
Please do, Art.
I have 2 comments on the panelists, all of which very important, interesting comments. One comment I have is, it is really a problem, which we haven't mentioned yet, about the willingness of people to accept vaccines. So it's one thing to prioritize, and it's one thing to say we have to share, and it's one thing for me to say we have to stabilize and honor our commitments to each other in that country. But the problem of vaccine hesitancy, the problem of people worrying about vaccine, a poll today, France, attitude toward AstraZeneca vaccine, a major vaccine in terms of the world, 61% of French people said, I won't take it. Germany, 54% said, I won't take it. It's not going to do us any good to make vaccine available anywhere if we can't overcome this doubt, fear, and hesitancy. And it's partly an ethics problem. Some of it is you have a duty to your neighbor to protect them. Some of it is you have a duty and an obligation to try and vaccinate yourself, understanding the risk relative to the benefit, that this is not so clear to individuals. They hear that a doctor got sick somewhere, or that South Africa got rid of AstraZeneca vaccine and sent it someplace else because of variants. We have to do much better messaging about this matter, or we are going to lose, because we're going to have a lot of vaccine that isn't in anybody's arm. So it's a major moral challenge to the world to come up with messaging that persuades people, calms people, makes them understand their duties, their obligations, and helps them think through properly the risk and the benefit. The other comment I'll reiterate, we have seen, as Awa commented, in Senegal, cheating, cutting the line, lots of important VIPs saying, I'll give you money, or I'm a politician, I go first. They sometimes do it pretending that it's about trust, but when you vaccinate your spouse and your staff and all their children, it's clearly cutting in line. We have to decide in ethics, are you going to have any penalties? Will there be any consequences? It's one thing to have a set of rules, and we did in the US, but there were no penalties, fines, nothing happened if you didn't follow the rules. So I like ethics. I believe sometimes people will do the right thing, but when they don't, we better figure out what we're going to do about it.
So other comments? Russ, did you start?
Yeah, so if I can just follow up on that. Look, we've had a number of key insights from all the panelists, and I think we have general agreement on what these concerns and pressures are. But what is the mechanism by which we incent and compel compliance with these policies? Not just hesitancy, which is a major problem still in the United States, and it is globally is an issue. But what are the structures and incentives that we employ to the different groups, different countries, corporations, private citizens, to ensure that they comply with a course of action that protects the world, basically, against a recurrent resurgence of a disease like this and the economic and social impact that it has? What's the mechanism? And that's a combination of ethics, politics, economics. I'm interested in this last year of finding solutions to this, and I think we have people are going to listen if we have something that we can put on a compelling basis at this point.
Yeah, well, you raise an interesting point, and Shebnem is actually going to go into your area, which is Art just identified a scenario where you have people who can't wait to get the vaccine, so they're cutting in line, and huge parts of populations that don't want to get the vaccine, even though it's available. Pretty dichotomous at that point in time. So Shebnem, your analysis at the macroeconomic level is that there are trillions of dollars on the table for loss if people don't get vaccinated. And at the microeconomic level, we have Dunkin' Donuts in the US giving away free donuts if you get vaccinated. So where is the macro-micro balance in your analysis, and how does that relate to Russ's comment about the corporations and the involvement there, and then Awa's comment about what's going on within Senegal and other countries in Africa and in the less developed, if you will, economically developed world?
Yes, let me clarify a few issues here. First of all, this vaccine hesitancy in general, before COVID, people not vaccinating their kids or not getting a flu vaccine. This is a rich country issue, okay? I mean, there is no such thing in developing countries. I mean, most, developing countries, emerging markets, the entire childhood vaccination done in schools, and, people get the flu vaccine. So this is, first of all, a existing vaccine hesitancy is a more rich country issue. Now, on top of that, the narrative during COVID, which is the AstraZeneca issue that Art mentioned, that's very unfortunate, of course, right? I mean, this is now a crisis where we need all the vaccines we can get. And there's this particular vaccine that we know that it's effective, just got into this, bad narrative that that is now up to a level where, you know, half of the France and Germany population says they are not taking it. So here, I think exactly you have to do that balance of micro, macro, Ken, you're asking. And this is the job of governments and private sector. They have to change this narrative, right? I mean, they have to really explain, bringing the scientists, you know, bringing the private sector, and government can do this because somebody has to manage this. No, this was the wrong narrative. This is the right narrative. And here, this narrative is going to have two parts. Not only that the vaccines is working for the vaccines that got this bad narrative like AstraZeneca, and also there is an economic side to it. If you don't get the vaccine, you know, there is a high likelihood that you are going to lose your job because your sector is going to be doing bad, because your sector has to stop production, say you are in the car manufacturing sector, because that sector is now, going through a chip shortage because the countries who are producing the chip, they are sick because they are not getting the vaccines, right? So it all goes together, and this has to be explained to people, right? I mean, if a person is willing to get a vaccine because they are getting a free donut, I mean, that person is going to behave even better if that person understands there's an economic incentive, not in terms of the country's economy, but also in terms of his or her own job prospects and so forth. So I think there is a tremendous responsibility here on the shoulder of governments and private sector also, because private sector is also very good at, you know, establishing the right, you know, narrative and explaining to people, bringing the right information, scientific information, and explain to people that, look, you know, vaccinating ourselves and the others is not only in our best interest in terms of, you know, we are becoming better and we are stopping the mutations and all these transmission through variants, but also we are also helping each other in terms of economic recovery.
Great. Other comments? Or let me then, Awa, please.
Yeah, just very quickly, I would like to support the issue of really messaging, and we need to do that in our countries in all languages, because it is not only in French or English, but also local languages, because people need to understand. In our countries, as John say, it was really not a problem to vaccine children. They almost have 90% of vaccination coverage. It was easy to have it. But with this COVID vaccine, we have been influenced a lot by all coming from all around the world. And the messaging is very important to ensure that people will come not because they of fear of, if I don't do that, maybe I will have a penalty or something like that, but I trust it and I want to do that. The second point is the issue of solidarity. I would like to share with you, we are a low-income countries. We are in Senegal, but when we bought the first 200,000 doses, it was very small, but we, the President Macky Sall had to decide to give some to Gambia and to Guinea-Bissau, just because he said to people, we cannot alone have vaccination, and all these countries are around us and people are going and coming, but people say, but you don't have enough, why you are giving to the others? So I think that the issue of solidarity, we need to put it very clear on our mind. And my last point, I don't think this will be discussed, but it is the issue of vaccine passport. For Senegalese, we are 95% Muslim. They want to go to Mecca. And Saudi Arabia has decided that if you want to come, you need to be vaccinated. So these are also some, we can say, issues put on the table, and people who want to go there have to be vaccinated. It's a sort of incentive or things like that. But I just want to share this with you too and support what has been said. Particularly, I have learned a lot on the economics issue, because this is something we need to use everywhere we are doing advocacy.
I'd like to just put in context, as I see it, the issue of hesitancy. I think it's an important insight that vaccination is not an issue outside of the developed countries. Everyone gets vaccinated. That's not the case in the United States. And as Art pointed out, it's becoming a serious problem now in all of Europe. If we can't get our house in order for this situation in which the advanced rich countries have fallen behind and can free up their resources to, as soon as possible, deal with the global issues that must be dealt right now, we just run the risk of delaying a response for a global solution. And I'm very concerned about the hesitancy issue. The messaging is complex, actually. There are numerous reasons why we have hesitancy. It's not monolithic. But if we're unable to break through, we're never going to get to the point in which we can tamp down the circulation of the virus and the development of variants that will ultimately are designed to defeat the vaccine population. And we will always have not just an endemic disease, but an endemic disease that has the potential of reasserting its pandemic nature in the next 5 years, the next 10 years, to the detriment of all of us.
So that Russ, I have so many questions that I had for the group, but we only have about 8 minutes left. And your statement just now, Russ, and actually the statements that all the panelists made is a perfect lead into what, unless there are some questions from the audience and we have time, is a perfect question. And that's this. When you read about events that are called black swans, they have primary characteristics, which are rarity, extreme impact, and retrospective, though not prospective, predictability. And once they happen, you never think about the world the same way. So the COVID-19 clearly fits that definition. What I'd like to ask the four of you in closing comments is, from your respective perspectives and in listening to the comments of your colleagues, what have you learned during this pandemic, and what would you do differently in the next pandemic if, and obviously hopefully not, when there is one? And perhaps we start, well, who would like to go first? Otherwise I'll pick somebody. Russ, you win.
Oh God. Look, I think, I think we have a rare opportunity now to bring the corporate sector, the NGOs, governments from all sectors of the globe together now and have an economic and political and ethically relevant agreement to be hammered out that protects us and has a logic to it that not just protects the lives of all of our citizens, but the economic and societal structures that we all too often take for granted. That, in my year of experience now dealing with major corporations in response to this pandemic, has led me to believe that this doesn't come along very often. The natural barriers to these types of alliances has been a bugaboo for us, and Art knows this, and Ken, and I'm sure everyone else, for many, many years. I think we have an opportunity to break down that barrier in, shall we say, enlightened self-interest and self-survival.
All right, Awa, would you like to, or Shabnam, whichever. Shabnam, you look like you were ready to go.
Sure. I think this is definitely a unique opportunity to push on globalization. I mean, we have to explain to the rest of the world and to the, kind of anti-globalizers and multilateral approaches that, the world has to do more on that. Actually, it's exactly the opposite. All these problems we are going to face from now on are going to be global in nature. Yes, globalization might amplify them. I mean, here we are talking about a virus, obviously travels from one country to another country, but the closing your countries and borders is not the solution. The true solution is going to come again through the globalization, through a multilateral approach. And this is an extremely important message to explain clearly. I mean, academic economists like myself really should push on their disciplines to, work for to better the world, to better the lives, and instead of, kind of focusing on more narrow issues. I think this is a moment to come together across the world and across fields and across disciplines, because this, as you said, we are not going to think the world the same way before, and then the future now seems to be suggesting we will have more problems like that we need to come together to find solutions.
Thank you. Awa?
My point will be to again repeat what has been said on the global health, and I will add security, because this will be a security problem, and we need to understand that in the future, COVID is just one. We had Ebola in West Africa some years before, but people were saying it is an issue of West Africa or Central Africa. Today we have a disease which is touching all the world. At the beginning, people were saying it's China, and after it was everybody and every countries. So this is a real global health security issue. The other one is at country level. We need to really improve community-based, I can say, actions, because everything will be resolved at community level. Policy is needed, everything finance, but if the community is not involved, it will be difficult. My last point I have learned more is the issue of humility, because we are all learning, we don't know everything, and if we don't listen to each other and look at multi-sectorial, it's not an issue of medical person or others, it's the issue of everybody. And having this approach, we will be, I think, successful. I hope.
Great, thank you. And Art, this is part of an ethics panel and journey, so the final word from you before we look at the poll, which we will do in a second.
We got the first word and the last word. Wow. Anyway.
And ethicists rule.
I'm going to go in a slightly different direction about something I learned, which we haven't mentioned. I think we need to have more transparency globally about science. Throughout this whole thing, I've been trying to understand, does the Chinese vaccine work? Did the Russians publish about their vaccine? Can we trust what AstraZeneca has now been flagged by its Data Safety and Monitoring Board? And I've been on about 25 of these in my life. They never go public unless they are really worried about something.
Never.
I can't remember anybody ever going public, but put that on the side. We need to have, in a global world, global standards of science, global agreement about transparency, and then we must do something else. We have to start to protect science and public health more than we have from political and ideological influence. The US got in a mess because the previous administration undercut science, destroyed public health messaging, and that impacted the world as one of the big powers. When Donald Trump said COVID is nothing to worry about, when he didn't accept public health advice about what to do to tamp down the epidemic before vaccines were here, it led to a disaster. And you can point to other countries. Brazil has been in the same boat and is now suffering because of it. So we need to make sure that science, public health expertise is protected from this kind of political manipulation around the world, not just in the places I mentioned, but everywhere. So I would say transparency. We've got to agree on what's evidence and how do you get it out there and how do you prove it. We shouldn't be uncertain about what vaccine works and what's safe and take our word for it or do it because we're giving it away. That's not the basis for vaccine policy, and it shouldn't be. And we need to come up with ways to give public health and science their voice without worrying that they're going to be put down or undercut or even punished by political authorities.
That's fabulous. I think these are all parts of the learning experience from the results of a pandemic that nobody foresaw and now everybody foresees in the future. I'm reminded of, my favorite quote is attributed to Earl Warren, which is, "Man is that strange creature who can only read the handwriting on the wall when his back is up against it." And clearly the world's back has been up against the wall of COVID-19. It's been a learning experience, I think, for all of us to watch how it's been addressed in different countries, by different groups, by different forces. And I think we've all learned a lot. Let's put up the audience poll and quickly see what the perspectives are. pretty even. Well, let me just see how it's pretty evenly split, except on improving surveillance and increasing multilateral funding seem to be the most. Boy, there are 300 people on this call. Not many people voted, so it's a little hard to judge from these numbers. But certainly, it says there's a lot to be done in a variety of different categories, and hopefully we've all learned that in the future, those various things will be done. So with that, thank you to the audience, and thank you clearly to our stellar panelists for taking times from your busy schedules to share your insights and to talk about this intersection between ethics and economics and industry and governments. This webinar was recorded and will be viewable on the Galleon Foundation's homepage, and we appreciate it. There will be other webinars from the Galleon Foundation. We look forward to your continued engagement. Thank you very much for joining us today.